Hello, everybody. Welcome to the 12th webinar in the SenzMate Connecting the Future webinar series. This is the very first event with a question mark in the title. And my name is Jose Garcia. I'll be your host for this event. We're going to give people about a minute to sign in. There's people here and there's people on LinkedIn Live. Just letting you know, this is going to be actually a 2-hour event. It's a 1-hour webinar, and we'll kind of say goodbye at the end of the 1 hour because we clip it for YouTube. We kind of say goodbye to YouTube at the 1 hour mark. And then the second hour, we're having an after party where it's a bit more free flowing. People from the audience will be brought on stage to comment and talk to the panelists or talk about their use cases. So here we've got a very specific focus on this question. And by the way, you don't have to agree with the premise. We're using this question mark to focus the conversation on edge devices versus cloud, when to use one, when to use the other. And I'm going to stop the preamble now because I am going to bring on our first speaker. And Ruben, welcome.
Hi there. Can you hear me?
Yes.
All right.
So Ruben, are edge devices the future? Oh, you can introduce yourself as well, but.
So I think it is being recorded, so I had to be careful what I say. But on the other hand, I believe it is going to have a big impact. So let me set up the stage where our experts will go more deep into how it is used. But if you look at the framework of AI and generative AI, and what you have seen is AI started 10 plus years ago with machine learning and AI. And then what happened was last 3-4 years, we hear all about ChatGPT and generative AI, and all of those came into play. What that did was basically it was training the data, which is all in the internet or all various aspect of it. They were doing the training. So when you do those kind of training on those information and everything, that normally goes into big data centers or cloud or wherever it is happening. But that was the foundation, you set that up. But then you look at it, how do you monetize that? How do you make useful of that data with the current data? So that's where the inference side of it. So the training is one technology. Then you have a second one called inference. So that start playing in what inference is. So basically you have a lot of information trained on that. As the new information comes in, which can be supportive or contradictory to the foundation all of it, and then that is where you start developing more and more value. And that is where the inference comes in. Now we are coming to the edge. What is the different on the edge side of it? So if you look at it, how like I remember still reading a paper by Google 20 years ago when I started my second startup about the people are asking question, how quickly you respond matters. If you don't respond within few millisecond or nanosecond, they will kill that search and they will move on to some other search process. So the similar thing here in at the edge, what we need to provide is the lowest latency where we can have impact, where people don't wait for hours and hours to respond, as well as get relevant information. So that is where the edge AI is going to be looking at it and see how it is going to work. So from the point of view of the first one, as I mentioned, you look to get the response quickly. The second thing is, if you look at the edge, it is working at, for example, we are going to talk about medical healthcare area, but you can look at it various aspects of it. Because I just launched a product for enterprise AI also with at the edge. So what all of these do is you have to look at the cost. because if you know Microsoft and Google and all these guys are spending billions of dollars, Meta, but we don't have that money for every enterprises and all that. How do you reduce the cost part of it? The second one, I talked about the latency. The third one is most important, is relevancy. So if you have the information what is matters to that particular one, you are able to do all of this. So when you put all of these together, the edge becomes so critical and very productive and useful for all different industries. And if you look at it, the medical part of it, which I always tell people that's the reason SenzMate and we focus on medtech area and healthcare area. The reason being, the reason being, if you look at it from the information, we have significant data which has been created by each medical institutions and medical devices, medical knowledge. Actually, interesting thing is I wear an Apple Watch. It monitors many of the things. My birthday was 2 days ago, and I got Aura ring my family gave me, which now monitors my sleep and monitors my heart rate and all of those kind of things. So these are, example of edge implications of edge coming into the your day-to-day life. But if you look at from a medical field, which we are going to cover from Taha, Sanjay, and Miller, what are the things we have been doing on various aspects of it is so important. For example, if you look at it from, I go across in the healthcare, you can start from the pharmaceutical area where there has been so much research, so much data is created. Having, I was talking to a Lenovo CTO. He was talking about they are creating a pod which can go and sit in the edge, which can develop the process, develop and all that. So what this reduces for them is the cost, because if you had to send all the data over the internet to cloud, that amount of traffic data, and then the relevancy of the data. So then if at the edge, you can do that. Then you go into medical field where, imaging, or you can look at it from pathology and all of these area. Yes, there are so much data is being created, but how does that come into play for you as a patient, as a doctor, as a provider? Because you don't want to know the world, but you want to make sure you address that one from the patient's point of view. Then you go into the various other area, like post-op, like Sanjay will talk about how Yogo Health is doing at the edge, at the customer side, as well as at the doctors providing side, how their technology is able to do some of those things. So if you look at all of these different areas of it, the edge is going to be very clear. And me being in Silicon Valley and being a very angel investor on all that, I want to give one example before I pass it back to Jose. So I had investment in two companies. One of the company, what they do is for your cancer, you can provide medication and all that part of it. But they found out, but your gut health, how your gut is able to do, what kind of acidic formulation and all that. So by converting them or preparing the gut to receive the medicine and have higher impact. So these guys are working on some, precision medicine on that. By experimenting at the edge, what kind of your gut health and gut chemistry, and then based on that they will give you some medicine, some kind of medicine upfront, which will go and convert it to prepare your gut to receive this medicine. When in this state, this will have high impact or high positive results on that. So these kind of thing, when you are looking at it, most of these work will be done at the edge. And I can go further and further into this kind of discussion, but I'm going to limit myself here, but I will be available to discuss more at the end. But to me, at edge it is going to be the next 10 years of growth or even further. And it is going to be a big change and big value for all of us. You're in mute.
I heard someone say they had an echo, so I thought, is it me? And I just wanted to say a quick comment, because I know a lot of some of the, I don't want to name names, but I know a couple of solutions use Google Gemini in the background, and they'll have a really long lag time during peak sometimes. And if it's just like 1 or 2 or 3 minutes, the oncologist can't use that during a consultation with a patient.
Patient.
Because of, like, especially if it's like, oh, how long is this going to last? So it's got to be, especially if it's during a consultation, they need it right away. They can't wait.
I mean, there are two aspects of that. Yeah, one of them is, as you said, patients are not going to be patient to listen to that. The second one is the payment system. And again, I keep bringing Sanjay's thing, because Sanjay and I talk a lot about that. The payment part of it is the challenging. And if you extend this time for the doctors to sit and wait, twiddle their thumb or talk about my Iceland trip, they're not going to be able to pay that money,
Thank you. We're bringing Ruben back. We're not getting rid of him. Thank you, Ruben.
Yep.
It's always to start the webinar with you. It's always good to have you at the beginning. And
Hope it makes sense.
Absolutely.
And here we go. Speaker number 2, Miller. Now we're getting.
Hi, everyone.
Thank you,
Pleasure to
Miller.
meet you all.
And Miller's really good at talking about use cases and edge devices. You're really, really good at it. And should I introduce you, or should you introduce yourself? I think
I'm good. So because this is, I think, we continuously participating. So I'm part of SenzMate. Whatever we are discussing here, we are pretty much hands-on on that. So I'm pretty much the spokesperson to take whatever cooking in SenzMate. So that's what my role and the CW of the company.
Excellent. Because I know we've done a bunch of webinars, but half the people who register for this one have never been to one of our webinars before. I wonder if you can get into it.
Sure, definitely. Yeah.
And use cases and opportunities.
Definitely, Jose. Thank you so much for having me today. So today's webinar, as you rightly say, whether edge devices will be the future, I personally believe yes, because we have been working on hardware, then we switched to generative AI wave and working a lot on that. And now after 3 years of Gen AI playing around everything, and you just throw something and you get it from cloud, now we feel edge going to be the next wave. Because whenever there is a transition happens, you can understand the transition and the trend when there are specific technologies are built on focusing on that particular area. So there was Bitcoin, and there was a wave crypto, then Bitcoin miners and hardwares have popped up. When there are energy, electricity and everything comes, the autonomous vehicle and very specific technologies, people worked on batteries. So when you can feel there is a technology will be the future, and there are plenty of add-on technologies going to build on that particular segment. When you consider edge, Gen AI was there are 1,000 plus chatbots, and where you can throw something and get information. There are thousands of applications comes in. But now you can feel there are very specific hardware built for using Gen AI. So that makes sense to understand, like edge going to play a major role, even though the serverless architectures and cloud is always there, the edge going to have a major role. One of the major issue, what it's focusing on, it's all about the data privacy. Second, how fast you want to access that information. Third, you might have limited requirement, but you're just pulling out information from an ocean of data and ocean of resources, which is unnecessary resources. So let's say you are into oncology, for an example. It's also a huge area, but it's very focused on oncology. You don't want to pull that information from a large pool of medical data, which is from MedPalm or anything out. So which edge in your premises, which allow you to access your data with very less latency, and you have unlimited accessing power where you don't need to pull out and pay according to the API calls. And you have an on-premises platform where your data and you are accessing on demand, but you have the experience, the exact same experience what you get it from a cloud platform, but in a local environment, in a very cheap variable cost, and you have in long term. So using that, now there is a trend bringing medical specific edge devices which do inbuilt anonymization of patient data, and very less connectivity to the cloud where you don't share your raw data outside the premises, very less latency, on time triggering alarms and alerts for your requirements and diseases to monitor, or critical conditions to identify. So people focusing on this medical industry specific hardware, and we are one of the use cases we are working on. So I think in the last midway webinar, I was touch upon this, where that time it was pretty much on a concept stage vision what we had, where there is a hardware, a on-premises device which will have engines of private LLM which hosted locally, and you working on your own rack-based data sources, pull out information, train your team with less resource utilization, working with people with different use cases and so on. Or you can have a computer vision engine which is plug and play. You can add your CCTV data or computer vision data or mobile or whatever the camera based modules, and you can have an on-premises hardware or a cloud engine which is on-premises. So the use cases are getting bigger and bigger for us on that case. So first of all, so we focusing on this hardware will be very cost effective, which will be on-premises, look like a small computer, that's it. The purpose of it, you have certain knowledge sharing for your employees on the ground. It could be a midwife, there are caregivers, there are individual nurses and below them or above them, and there are administrative officers working on the medical industry, pharmacists to doctors. There are plenty of user roles and stakeholders playing on a premises, and there are plenty of medical records that cannot be shared outside. So they handling this data for various requirements in terms of treatment, in terms of monitoring, evaluation, analysis, and giving some feedback and updating those profiles. So having an on-premises platform which on demand you can pull out information and it's guide you what to do and train your staff, and without any hesitation 24/7, and you can clarify issues just like a specialist sitting on your table. So all those things will be trained into an AI platform. Why it's better than the cloud platforms, where you don't want to pull out information from a large team. You don't want to share your patient data to the cloud platform where it get trained from a personal data, which is a violation of HIPAA from the day one itself. So, and the most important thing, the latency. You don't want to pay for a large sum of money to get that speed and latency issues to sort out, which is one time you have it in your premises, whatever the data you're throwing out, which will be learned from it internally and give a latency-free update. So, starting from training your staff and getting towards advising patients directly, and customer care on the or first level of information gathering from the patients, telemedicine access. There are 1,000 applications we see just by adding a private LLM on a dedicated hardware, and we believe this kind of a future for at least for another 2 years.
This is my first webinar, but I keep doing that. If you, we're going to bring on our next speaker. If you have a use case that you're developing or you're curious about, Miller's going to be around during the after party, and we can bring you on the panel to speak with him, and he's very good at taking apart your use case and giving you advice. So we're bringing Miller back. We're getting rid of him now, but we're bringing him back. And now, our third speaker, and Ruben mentioned him at the beginning, Sanjay. I'm bringing him on the stage. Welcome.
Thank you, Jose.
I wonder, so they've actually, we mentioned Yogo a couple of times during our webinars, but most people, not everyone here is familiar with you. I wonder if you can introduce yourself.
Thank you, Jose. Thank you, Ruben. It's wonderful to be with you this morning. So Jogo Health is a neuromuscular therapeutic platform. So it works off of the EMG signals from the skeletal muscles, and we address conditions as diverse as spasticity due to stroke, Parkinson tremors, essential tremors, pelvic floor disorders, both on the bladder side, incontinence, bowel incontinence, as well as chronic pain, migraines in particular, chronic low back pain, etc. So this is a very exciting platform. We are commercializing over 2 decades of research at NYU Rusk Institute with a small wearable sensor. I think you all saw what Ruben was wearing. So that's where medicine is going these days. It's smaller sensors and using what's called neuroplastic changes in the brain to alleviate the disorder impact. Yeah, that's in a nutshell what Jogo Health does.
Thank you. I'm wondering if you could get into the plumbing of your use case.
Yeah, so I think this is a very interesting topic, and we've certainly been served well with this technology. So let me just step a bit back, Jose, if I may, and just kind of give you the feel for the environment in which we operate. Right? So today, gone are the days when you drive 30 to 40 minutes an hour, wait at a doctor's clinic or a therapist clinic, get treated, and then come back, although it does exist to some extent. But a lot of it is moving to a very hybrid situation wherein you do the treatments at home with wearable sensors, you have a remote therapist, you have your first consult with the MD, and then you take the prescription, do the treatments at home, and then you come back for a final visit where you get reassessed and so on. So a lot of the sensing technologies have developed. So that's point number one. Everything's moving to a hybrid care. Second is privacy is very, very important in healthcare, because when you capture sensing, it's private data, and we do capture the video of the patient. So no patient likes his video to be transmitted, stored somewhere in the cloud. So we have to anonymize that, take the picture away, put a skeletal image instead of the identifying features that's present in a video, and also anonymize the data to a large extent so that it's not identifiable. So that's very critical. Third is the workflow. So we expect that each provider sees 3 to 4 patients in an hour. So the issues that both Miller and Ruben were talking about, relevancy, latency is very critical. We can't wait for like a minute or two to get a response, because that minute or two will just compound through the day, and the patient you see in the afternoon will be waiting longer to be seen than the patients who come earlier. So it has a cascading effect through the day. When you line up patients, you have to get them through the therapeutic process. So relevancy and latency, very important, as is cost. As Ruben alluded to earlier, nobody gets paid to chit-chat with the patient. We have a 15-minute window where you need to understand what you need to deliver the treatment. Of course, this doesn't mean that we are robotic with our patients, but what I want to highlight is, it's very, very time sensitive. So the devices have to respond. And I think Edge AI solves this issue very neatly for us. I think the concept of private LLMs has been very useful for us, because it's an immediate feedback to the therapist, to the patient. And the cost is also, it's lightweight. So it's able to reside in a mobile device, a tablet, if you will, or a smartphone. So that's also extremely critical for us. Right? So we do, as I mentioned, treat a variety of indications where we're actually capturing the video of the patient. If you're correcting some gait issues, and pelvic floor issues where, private areas of a patient are exposed. So it's very critical that, we anonymize that to a large extent, just get the relevant data into the cloud, but a lot of the processing is happening locally. So I would say edge and healthcare go very well together. And those are my, quick thoughts, Jose. Happy to take questions.
You know what? I think also people say, a minute or two. But I've noticed, like, if you've got the really big cloud-based LLMs and they're lagging, it's not going to tell you, it's a minute or two. You don't know how long it's going to be, too. And I'm going to.
So if I may ask, Sanjay, because I think we have a few minutes on that. I think that some of the part you talked about at the edge for privacy and for mainly the pelvic area part of it, or some of these, and I think you're absolutely right that at that edge where you can anomalize as well as you can do a digital twin or that kind of thing at the edge, and by doing that, sending the necessary information, not private information, those things are better navigated at the edge than in the cloud, because once you get in the cloud, you don't know where it is there, what it is doing, so you better control up front.
Yeah, no, absolutely. So a lot of this, this private LLM concept is key, and in the cloud, I think we do a lot of machine learning, if you will, and kind of looking at a population level. Okay, we've treated 100,000 patients. What's working really well, what's not working well. So that's useful in the cloud. But when you're dealing with the patient, it's a one-on-one care setting. I think the edge is powerful.
Well said.
Just want to give a contrast between, where cloud fits in very well, where the edge fits in very well.
Thank you. Well, we're going to bring Sanjay and Ruben back. It's now time for our final speaker, Taha. And let's see, boom. Welcome.
Hello, everyone. Thank you, Jose, for the kind introduction. And yes, I'm delighted to be here and follow the brilliant leaders of digital innovation who just spoke before me. So a little bit about myself. I'm Dr. Taha Khan. I'm a general practitioner in the UK. Internationally, that's also known as a family medicine consultant. Beyond clinical practice, I wear other hats. I'm a clinical lecturer, and that means I'm responsible for training the next generation of doctors. I'm also a clinical safety officer, and that means I ensure that these digital innovations in healthcare meet the stringent safety and regulatory standards. So it's a real privilege to speak here with you today about validating edge devices in healthcare. And this is a very important topic that it really sits at the crossroads of innovation and patient safety. So I'm just going to summarize from a clinician's perspective a little bit more about edge technology and its use cases, and then its validation. So as Miller, Ruben, and Sanjay mentioned, edge technology refers to devices that are run locally. So, like Ruben showed, that can be wearables. It can also be on smartphones, and it can also be medical sensors. And this is different to traditional technology, which is based in the cloud or in central servers. So what does this mean? Essentially, it means that the data is processed where it's generated. And that's why we refer to it as the edge of the network. There should generally be little or no need for internet connectivity. And if you've got AI involved, the responses can be in real time and private. So how does this matter in healthcare? Well, first of all, you should have improved privacy and security. The patient data doesn't necessarily need to leave the device. And that means it's more easy to comply with the data information standards. And in the UK, that's known as GDPR. So the lower risk of data breaches or insecure transmissions, essentially. Also, as we discussed earlier, you're more likely to be able to get faster real-time responses. And this is ideal for applications that need more immediate action. For example, seizure detection, arrhythmia detection, and glucose level monitoring, where we really need to act as quickly as possible without delay. Another example is, for example, fall detection in frail elderly patients. Thirdly, I wanted to discuss the resilience and offline functionality. So the advantage of these edge devices is that they should be able to keep working even if the internet fails. And that means they provide unique advantages in other settings. For example, they can work in the homes of elderly patients who may not necessarily have things like Wi-Fi, and they can also work in deprived areas, rural areas where the internet connection is bad, and also in areas that are affected by war, for example, in Ukraine or Palestine or Iran. The fourth thing I wanted to discuss is that on average, they have a lower latency and bandwidth use. So because we're not required to transmit large data sets to the cloud, it's generally has a lower latency. And that means it's useful for more high frequency data. And that can be things like EEGs, which are useful in detecting seizures, and ECGs, known as EKGs in America, which are useful for detecting arrhythmias, or even things like video monitoring or accelerometers, which can detect falls. So those were some of the key considerations in healthcare. But in particular now, I want to discuss the challenges. So often some of these devices have challenges regarding the limited power and the memory. So small devices can only run relatively lightweight AI models, and that means they're not suitable for very large neural networks unless they are maybe compressed or pruned. Also, because they're run locally, it can be harder to update them and validate them. As you can imagine, managing software updates across thousands of devices can be difficult, especially if you're a relatively new and relatively small medtech startup. Also, the safety and clinical performance would need to be revalidated after every update, and that's in place due to the MHRA and DCB standards, which apply in the UK. The other challenge is integration with the clinical workflows, and we discussed this earlier briefly. The insights from the device, if you want medical opinions on them, they must be able to flow easily and quickly into the electronic health records for me to be able to give you the corresponding advice. For example, if it's monitoring your sleep or if it's monitoring you something else. And time really is critical, because an average appointment with me in the UK is about 10 minutes long. So for me to be able to review the data, I need to be able to access the relevant parts seamlessly. Therefore, without integration, there is a real risk of either duplicating work or missing important clinical events, or simply underutilizing the data. There are numerous use cases in health, but we have to make sure that we use them safely and carefully. I mentioned some of them already, detecting seizures, arrhythmias, glucose levels, and falls, but there are also I'm seeing increasingly even more uses, and that's things like smart inhalers, where they use and they track the usage and they give you alerts. And you can also get they use in remote rehabilitation, so motion tracking wearables, where they can analyze things like your exercise form. And so I hope that's a useful kind of introduction and context to edge devices. Now I'm going to tell you a little bit more about the validation. Since I'm based in London, naturally, I'm going to be talking primarily about the British standards. So the names will be different based on where you work, but the general principles I'm outlining will be very similar. So first of all, what do we mean by validation? So validation in healthcare means proving that a product or system works safely and effectively for its intended use in real world conditions. Why does validation matter? Well, it's basically a legal and ethical imperative So in the UK, healthcare providers must ensure that digital tools comply with our safety standards. And that's specifically things like the DCB 0129 and the DCB 0160. So the first one, DCB 0129, it governs the manufacture of these digital innovations to ensure that they are designed with risk mitigation in mind, whereas DCB 0160 considers their deployment, guaranteeing that they are safely implemented for real-world use. The concept of digital clinical safety is important because it refers to managing the risk of harm to patients, and it needs to be considered across the full digital system life cycle, from innovation to deployment, because it's part of the broader patient safety culture. And clinically safe data systems should be free from unacceptable risk, be supported with evidence that demonstrates that the risk is indeed acceptable, and they should have features that can mitigate risk where necessary. Things that are outside of the DCB standards are security and information governance, which I'd be very happy to discuss later if needed. The other thing that I should tell you about are the DTAC standards, and that stands for Digital Technology Assessment Criteria. So digital tools are now evaluated in the UK's national health system by the DTAC criteria. So any developer, if you're a developer or you've made a system and you want access to the NHS markets, then you need a DTAC evaluation. And that's a 5-step process. So it requires clinical safety, and that's the DCB 0129 and 60 standards that I mentioned earlier. Data protection. So your product needs to be assessed to ensure that the data protection and privacy is by design and the rights of the individuals are protected. Thirdly is about technical assurance. So products need to be assessed to ensure that they are secure and they're stable. Fourth, out of 5, is the interoperability, which I mentioned earlier. So the products need to be assessed to ensure that the data is communicated accurately and quickly, whilst it again stays safe and secure. And finally, usability and accessibility, where products are allocated and they have a conformity rating which has been benchmarked against good practice in the NHS. The other thing to bear in mind is that in addition to the DCB standards and the DTAC criteria, edge devices can be subject to medical device regulation. So what is a medical device? Well, it's any instrument, apparatus, appliance, software, material, or any other article which is intended for human use that performs a medical purpose, and that can be diagnosing, monitoring, or treating a medical condition. And the medical devices can be hardware or software. So they're used for diagnosis, prevention, treatment, alleviation of disease, even contraception. There is a wide range of uses. The way we categorize medical devices is important as well. We have 4 classes. Class 1, which is low risk, class 2A, which is medium risk, and so is class 2B, a bit higher, and then class 3, which is generally regarded as high risk. Most of the edge devices I've seen are generally regarded as class 1, which is low risk, and some of them are also class 2A, which is medium risk, and that determines what type of regulatory requirements are required. If you buy them in the UK, there are patient obligations, and you're advised to make sure that it is suitable for your medical condition, that it has the CE marking or the UKCA marking or the CE UKNI marking. You should be able to check the manufacturer's address is on the device or on the packaging, and you should get a demonstration of how to use the device, especially if it's one of the more complicated devices or procedures. Also, as a patient, you should be able to know if the device is faulty or if it's not working, what you need to do. So as a developer, that's things you need to be able to make clear to your patients. They also need to ensure that the device is not damaged. They understand how to use it, so you must write your instructions clearly, and the device needs to be registered with the manufacturer so that the manufacturer can contact them if there is subsequently a fault or a safety problem that is recognized with the device. You also need to make sure that you've got everything you need to run the device. That might be batteries, or it might be something else. And patients are responsible for keeping the device in good condition and following the instructions that they've been given about the device. So the legislation of medical devices that applies in Great Britain is complex, and it's also been affected by the UK leaving the European Union or EU, which we refer to as Brexit. So that Brexit has made this a lot more complicated. The UK conformity assessment, the UKCA mark, is a new UK product used to identify goods being placed on the market in Great Britain. The products may also carry the CE mark, and that's to show conformity with the European health, safety, and environmental protection standards. The standards are very similar, although they can change with time. But at the moment, they are certainly very similar. Who is responsible for regulating medical devices? Well, it's the MHRA, and you can Google that if you want to. It stands for the Medicines and Healthcare Products Regulatory Agency, MHRA, and they're responsible for performing market surveillance of medical devices on the UK market, and they can take decisions over the marketing and supply of devices in the UK. So they're responsible for the designation and monitoring of the UK conformity assessment bodies. So that means the companies that need to assess their product to determine if it fails within medical device regulations, and if it does, a UKCA a UKCA or a European CE mark, depending on its historical and future deployment. And that can be either self-certified or it can get it via a notified body. So I hope that's a useful summary of their use cases and the validation and the relevant DCB standards, DTAC standards, and the medical device regulations. Thank you very much for listening. If you have any further questions, I'll put my LinkedIn in the comments and you can reach out and I'll try my best to answer.
Thank you. We're keeping you on screen. Bring everyone else on. This is the group hug. And we got a couple of comments from the audience. And the first one, thoughts on NFC tech. This is like RFID technology.
Yeah. Various technology on this part. I don't know, Miller, you want to address that? I think we have in the highest level from my background is the telco. That's how I started my life in US and worked for various companies and defining various parts. And that became, with Bluetooth to various aspects of communication part of it. RFID is one of them. But when it went into medical field, I think there is plenty of use cases. Correct, Miller? You are mute.
Exactly. So the use cases are huge, and it's considered a little old technology at this point of time. There are plenty of biometrics and everything came on to protect your data and make it more personalized and so on. NFC is one of the easily accessible and it's widely spread technology. If you build something on top of NFC, it's easily replicatable in many parts of the world, and it's accepted technology. If you take other communication like LoRa for an example, how the communication works, or Sigfox communication, how the data transmission works, there are bandwidth issues, the spectrum of communication, there are plenty of issues on that. But NFC, it's a very much saturated, well accepted technology. But the drawback of that, it's near fail. That's obviously the name itself. It's supposed to be touched through your mobile and so on. Now Apple and all, they have their own NFC. Every phone comes with NFC communication. So that's an opportunity on that. But the drawback, it can be rewritable. It can be receive information with very simple tactic because it's an old technology. So that's only one risk in terms of keeping a medical record or a profile on top of an NFC card or an NFC access code. It's very hard to, it's not that hard in terms of cracking that and take the information. There are high-end technologies at the moment which use biometrics at the point of time.
Yeah, I think to add to that, NFC as defined as the standard, it had, I would say, as we go forward, limited use, but in the NFC concept of near field communication and with more secure, more private, more part of it, it has evolved over various wireless technology. So I think again, I keep pitching SenzMate because we are at the cutting edge, at the front of all these various conversation. So if you look at SenzMate AIoT, what we talk about is AI one side, IoT, Internet of Things. So that part of our work is talking about looking at all these latest technology which can do near field communication to long term and low power, various aspects of it. We have the internal capability to build products on that. And even, if somebody has some questions and they want to have a conversation with Miller and our team, they can reach out to us through Pabodi or us and say, hey, we want to have some expert consultation because we have a lot of knowledge in this field.
Yeah, one example I can think immediately, one of the major issue in terms of handoff document from one doctor to another doctor when there's a transmission happen, when one nurse to another person, when you're switching hospitals because of we have to move for different cities and all. So even Google working on that context, like how to make more auto-generated handoff document, how to transmit handoff document securely about your personal medical data. NFC could be a perfect use case because you carry your NFC card along with you. When you tap, it's updated. You take it to another place and tap it, and you have all the information transmit, and there's no third person because your ATM works in the same way. So I think that's an amazing use case to have it in NFC.
Hey, I'm bringing somebody from the audience onto the panel, and let's see. Oh, it takes a couple of seconds. Sarah, are you here?
Hello.
Hello.
Hi.
Welcome, Sarah.
Hi. I was just following a trend. I thought I'd stay muted. Happy birthday for a few days ago, Ruben. I hope you had a lovely time.
Thank you.
So I've worked in digital health now for a number of years, and one of the biggest aspects is giving patients access to the right care at the right time, reducing the strain on the NHS, which is the national health system within Great Britain. And I think for me, the way that Edge AI is revolutionizing healthcare is really, really important. The fact that you can have the data in your hands, in your pocket, immediately, and the only data that gets shared with the health providers is critical data that needs to be reviewed, etc. My question would be, and Taha, that this may be a question for you, with regards to strains on clinical providers, whether it be the NHS, whether it be the health system in the US, how much of an impact do you think that Edge AI is going to have on the health services, whereby you are giving power to the patients to actually effectively look after themselves to a degree, but also taking the strain off the healthcare organisations?
Yeah, thanks, Sarah. I think that's a brilliant question. The answer is challenging because ultimately it depends. It depends on how we're able to produce this technology. It depends how effectively we're able to do things like ensure its interoperability and educate patients regarding their use and ensure their validation. But one of the challenges is that whilst this technology can empower patients and it can give them access to additional data, I often see the reverse of it, where I see patients being generally asymptomatic, but their unvalidated medical device, edge device, picks up mild abnormalities, the consequences of which they don't understand, and they routinely kind of seek GP consultations to try and discuss this, to find out more, and we're actually having to tell them that some of the information here is unfortunately meaningless because it's not been validated and you're asymptomatic, and then you always run the risk of the things like the retrospective bias where you attribute previous problems to perhaps an irregular sleep pattern if you wear the sleep ring. So the potential there is great, but it depends very much upon how we use it. In order to realize that potential, I would fundamentally stress the importance of co-production with doctors to ensure that it meets the patient values and it brings tangible value to clinical practice, because a lot of the information is frankly just noise, which is not always helpful. But if we make it in the right way and it's validated and regulated, yes, it can be very helpful indeed.
Actually, Taha, to tag on that, I think 1 or 2 session earlier, we had a nurse participating in this event as a, she was so angry because she was saying, they don't talk to us, they don't consult with us, they bring these devices and say it is going to improve productivity and all that. You hit it right. You need to talk to them, you need to consult with them, you need to see how this can be helpful and improve their productivity and all that, while reducing the stress on them with the technology. Yeah, so very nicely said.
Thank you. And we'll start the after party in about 8 minutes. And I hope this doesn't confuse people, but I'm going to say goodbye in 8 minutes because we clip the event for YouTube. So we say goodbye to YouTube in 8 minutes, but we're going to continue. Thank you so much. Did I answer your question, Sarah?
Of course, I went on mute again. No, absolutely, and I think as you mentioned, the collaboration between partnerships and providers, I think, is extremely important, and finding out what patients need, but also what fundamentally the NHS needs, and what devices are going to help them. And also, obviously, with certain partnerships in the UK, we have a company called Orca that will run tests on our mobile devices, on our mobile apps, digital health apps, to make sure they're fit for purpose, to make sure that they are actually clinically proven, safe, etc., and that the patient understands. And I think many GPs now within our primary care system are having consultations with patients to start to make sure they understand how to use the mobile devices, and what the data actually means. So exactly like you said, Taha, so they don't start to panic, and they understand that the majority of the data they see is just everyday data. So I think, again, not just partnerships with the providers themselves, but I think the GP communication with patients, again, is extremely important as well, so they understand, especially within the older community, where obviously, sometimes medical devices such as this can be seen as sort of witchcraft within the older community. So again, I think it's a working partnership. It is extremely important on all levels. But no, thank you very much, and it's been a really, really interesting talk today. So I appreciate your time, guys. Thank you.
Absolutely. Yeah. So one thing I want to bring back, actually, Sanjay onto this. I know, Sanjay, as you partner with Mayo Clinic, as you guys working with how the Boston-based couple of them, as well as New York, what you are seeing from US aspect of it, the resistance versus how the doctors and physicians are responding to your partnership with Yogo at these institutions in US?
Yeah, no, great question, Ruben. I just want to echo what Taha said earlier. So what we're doing, Ruben, is we're working very closely with the provider, be it an MD or a therapist, educate them of what the device can and cannot do, as well as educate the patient themselves. So we mediate everything through the provider, and we're just providing the education, and we're there for support, but the patient is always communicating with the provider. So we say, okay, if you're seeing these things, don't freak out. It doesn't have any clinical relevance. Always talk to a provider first, right? Because they're the ones who have the clinical picture, which is very important to keep the clinical picture in the background. Because, tech is a good tool, and it's important to work with the providers and the patients, make sure that they're both supported, so they get the best out of the technology without removing the provider. So yes, so Mayo Clinic has responded very well, so has Mount Sinai and other providers. And at the end of the treatment, we also flow back our observations back to the referring provider, saying, okay, here's what we see, and this is standard clinical medicine. If we see some red flags, yellow flags, green flags, we flow that back to the therapist and say, you please talk to your patient, because we don't want to freak out the patient. It's better that it comes from the provider.
Okay, we've got a lot of questions that we haven't addressed yet. We're going to have to kind of answer them in a few minutes in the after party. We're about to say goodbye to YouTube. So I'm wondering if we could just do a quick final word. Miller, quick final word, like if you keep it under 20 seconds.
Sure, definitely. So, I think it would be reasonable to answer one of the questions in the chat as my final word. So, the question is why, if the patient give their data with consent, why EPI will be a concern for edge computers and cloud? I think it's not about the patient's concern. How the health center and the stakeholders handle the data, process the data, share the data, store the data. It's all matters for EPA. So that's one of the major concerns. Even if patients willingly share the data with the center, how it was processed for further analysis through edge or in cloud will be definitely applicable for EPA. So to keeping on that concern, we have to play with boundaries. So edge will solve many problems and give you a gray line where you can play around with security, privacy, and still provide the technology what you are looking for.
Ruben.
Yeah. So, thank you. For my part of it, I say, because the precision medicine, which I am so fan of it, because it used to be everything is given to everybody and give Panadol or Tylenol for headache and all that. Now you find out the root cause of it and then go and treat the root cause rather than the symptoms, and those kind of part of it. And with that amount of data, that amount of part, if you had to go to cloud and do all that, the expenses will be so significant, the delays will be important. So how do you manage that? To me, the best solution will be at the edge and where it is closest to where it is need to be, and only take the metadata or the important data and store in the cloud for future analysis, training, and all that. So from that point of view, to me, this precision medicine or which can be done at the edge is so critical.
Thank you. Taha, final word.
I think we're at a really exciting time in medicine, in technology, and in society. But we must remember that although these technologies afford us great power, they come with a lot of responsibility. And that's why it's important that we have patient safety as central to when we are developing them and when we are implementing them. Because ultimately, they're the people who we do it for. These technologies are very different to those that you might see in things like the business sectors or other sectors, because there is real risk to people's lives if we get them wrong. So, be very careful, use them very responsibly, and, as we discussed earlier, make sure you co-produce and you engage as relevant stakeholders, patients, doctors, etc., and you educate people properly so they know how to use it safely and responsibly.
Sanjay, final word.
Yeah, no, healthcare is a team sport. We have to work together. There's multiple stakeholders, technologists, caregivers, physicians, etc. My late dad was an anesthesiologist, and he practiced anesthesia in an era where he had to send the wait for the blood gas analysis to come back from the lab while the patient is on the table. So he had to use his clinical acumen to figure out what's going on. So that used to take about an hour for the report to come. And, patients, if it's critical, they don't last that long. So I think these tools are extremely powerful, and echo what Taha said earlier. I think we need to work very closely with the providers so that the tool is really to help them, to help the patients. And the more we can synchronize and deliver something that helps the whole ecosystem, I think we got a winner.
Thank you, everyone. We're saying goodbye to YouTube now, but we're not ending the event. We go to the after party. I want to thank all our panelists and the audience. I know we've got some questions. We're going to ask them. We're going to address the questions in the after party. And thank you so much for coming. Goodbye, YouTube.